Hello, this is Welcome to Medicare, provided by Nebraska SHIP. Nebraska SHIP is a federally funded member of the SHIP National Network. We also administer the state's SMP or Senior Medicare Patrol. Nebraska SHIP is a division of the Nebraska Department of Insurance and has 7 locations to serve the state. These 7 locations serve as home base to a network of over 300 volunteer counselors in partnership with Area Agency on Aging offices and volunteers assisting seniors. Our counselors provide free, confidential, and unbiased Medicare education and counseling. Our office can be reached through our statewide hotline at 1-800-234-7119, where you may speak with the location nearest you, or visit our website at www.doi.nebraska.gov/ship. The topics that we'll cover today will include Medicare Part A and Part B, Medicare supplements, sometimes known as Medigap policies, Medicare Part D drug insurance, Medicare Advantage, sometimes known as Medicare Part C. We'll address the differences in your options and conclude with a discussion of Medicare fraud and abuse. But before we discuss these topics, we briefly want to review a few terms you should be familiar with since you will encounter them in your use of your Medicare benefits. First, you would be responsible for premiums with your Medicare, the monthly amount you pay to have your insurance in place. Other costs will include a deductible, the amount an individual pays prior to their insurance kicking in. And in order to meet the plan's deductible, you may encounter copays and or coinsurance. The basic difference is that copays are typically set dollar values, whereas coinsurance is a percentage of the full cost. Finally, depending on your decisions, you may find that your insurance has an out-of-pocket maximum, which, once met, the insurance will cover at 100% throughout the end of the calendar year. So, what is Medicare? Well, to put it simply, Medicare is federal health insurance created in 1965, signed into law by President Lyndon Johnson. Now, in order to qualify for Medicare, a person must meet one of the following 3 criteria: be either age 65 years of age or older. If the individual is younger than 65, they should have a qualifying disability or end-stage renal disease. When a person becomes eligible to receive Medicare, they will need to decide how they want to receive their benefits. One option is known as Original Medicare and is comprised of Medicare Part A, serving as the hospital insurance or inpatient care, Medicare Part B, serving as medical insurance or outpatient care, potentially a Medicare supplement or Medigap policy, which helps with Part A and Part B cost. The fourth potential part of Original Medicare is Medicare Part D, serving as prescription drug coverage. The alternative to this option is Medicare Advantage, sometimes called Medicare Part C. This option combines Medicare Part A, Part B, and typically D into one package and provides equal or better coverage than that provided by Original Medicare. Both options are viable but work differently regarding coverage and cost. We will begin with Medicare Part A and Part B. Medicare Part A serves as hospital insurance and covers these 4 services: inpatient hospital care, skilled nursing care, home health care, and hospice. Now, when we see skilled nursing, please do not confuse that with a move into a nursing home. Medicare, like most insurance, does not cover long-term care cost. Instead, think of skilled nursing as receiving physical, speech, or occupational therapy. Now, Medicare Part A is typically premium free since it's already been paid for through 10 years of employment paying Social Security Medicare taxes. But remember, Medicare Part A does have deductibles and copays. For example, in an inpatient hospital stay this year, 2021, the deductible is $1,484, which pays for the first 60 days of hospitalization. Care is available beyond these 60 days, but a daily copay will be assessed beginning on day 61. Now, in the event that a person receives skilled nursing care, Medicare Part A does pay 100% for the first 20 days. Beyond that, care is available for up to 100 days, but a daily copay will be assessed. Medicare Part B serves as medical insurance and pays for outpatient services that are medically necessary. This can include doctor or specialist visits, outpatient care, mental health care, medical supplies, ambulance services, and preventative services like cancer screenings, depression screenings, or flu shots. Medicare Part B also pays for durable medical equipment such as blood sugar monitors, CPAP devices, infusion pumps and supplies, or even wheelchairs and scooters. For a list of common Medicare covered test services or items, you can refer to your Medicare and You handbook or visit Medicare.gov or, of course, contact Nebraska SHIP. Now, Medicare Part B has a standard premium of $148.50 per month in 2021. Individuals with a higher income may see an IRMA or income-related monthly adjustment amount. This notification is received from Social Security and communicates the additional premium that the individual will need to pay. This notification also contains instructions on appealing this decision in the event that you believe the determination is incorrect. Life-changing events may qualify for the reduction or the elimination of the IRMA. Beyond that, Medicare Part B does have an annual deductible. This year, that amount is $203. Once met, people share their cost with Medicare Part B at an 80-20 split. Medicare covers the 80%, and do note there is no cap on your 20% share.
So, where can you use your Medicare benefits? Well, Medicare Part A and Part B are the most widely accepted form of insurance as long as a doctor or provider accepts Medicare and is able to see you. Your Medicare will pay for your medically necessary services. Now, there are two questions that you may want to ask in order to better understand your potential out-of-pocket cost. The first is, do you accept Medicare? If the answer is yes, then the next question you may want to ask is, do you accept assignment? The reason you may want to ask this question is because there are some providers that accept Medicare, but do not accept Medicare assignment. So, what is Medicare assignment? Well, assignment is the dollar amount that is assigned to a service. If a doctor accepts assignment, they agree to charge you only the deductible and co-insurance amount and usually wait for Medicare to pay its share before asking you to pay your share. Providers that do not accept assignment can charge you more than the Medicare approved amount, but no more than 15% over the assignment value. In some cases, you may have to pay the entire charge at the time of service. In that case, you may have to submit your own claim to Medicare to get paid back for the assignment amount for that service received. So, what about enrollment? Well, Medicare enrollment is automatic for those individuals who have chosen to receive their Social Security or railroad retirement benefits before the age of 65. Now, if you're auto-enrolled, you should receive your Medicare card typically 2 to 3 months before your birth month. If you are not receiving your Social Security or railroad retirement benefits, you will need to enroll into Medicare yourself. Enrollment into Medicare at age 65 is known as your initial enrollment period. During this time, you may enroll into your Medicare anytime during a 7-month window beginning 3 months before your birth month and ending 3 months after. If you enroll in the 3 months before your birth month, Medicare will begin on the first of your birth month. Enrollment during your birth month or after will result in a delay of coverage. Now, you may enroll one of 3 ways. You can visit your local Social Security office, you can call Social Security over the phone, or you may enroll online, which may be an easier and faster way by going to Social Security's website at ssa.gov. Once enrolled, you'll receive your Medicare card in a few weeks. Now, if you plan to continue working after age 65 and you have insurance coverage from active employment, you are not required to enroll into Medicare. The same is true if you are covered under your spouse's insurance from active employment. Now, most people do enroll into Medicare Part A because it's premium free. If you make this decision, your Medicare will pay secondary to your group health insurance. And do note, if you have an HSA or health savings account, you may want to delay enrollment into Medicare because doing so will require you to stop making contributions to the HSA. If you do have an HSA, please contact your local Nebraska SHIP office for more information or speak with your benefits coordinator.
Now, those individuals who work beyond age 65 and have insurance from that employment, they will be able to enroll into Medicare during what's known as a special enrollment period. Enrollment can be done anytime while still covered by the group health plan or up to 8 months after the loss of the insurance. Individuals should consider coordinating enrollment into Medicare with the loss of employment insurance to avoid gaps in the healthcare coverage. Now, if a person does not enroll during their initial enrollment period or during a special enrollment period, they will be restricted to enrollment into Medicare during what is known as a general enrollment period. Enrollment during this time is restricted to the first quarter of the year, and coverage does not begin until July 1st of that year, and late enrollment penalties could apply.
So, how do you avoid penalties? Well, Medicare late enrollment penalties will exist if a person does not elect coverage when they are initially eligible at 65, or if they do not enroll during a special enrollment period at retirement and do not have coverage in place. The only credible coverage for Medicare Part A and or Part B is insurance from active employment, whether it's your own or your spouse's. Typically, most group insurance from employment is creditable if the employer has more than 20 employees. You can ask your HR representative or benefits coordinator if your insurance is considered creditable for Medicare. If it is, then you are not required to enroll into Medicare when first eligible, and you would not see a late enrollment penalty fee at retirement. Now, coverage from other sources, such as COBRA, retiree plans, VA, or from the marketplace, are not considered creditable for Medicare. Remember, only insurance from active employment is considered creditable for Part A and Part B. And finally, remember, Medicare penalties are lifetime penalties, which are paid each month in addition to your premium costs.
Now, we touched on what could happen to premiums if a person has a higher income. What happens to those individuals with lower income or limited resources? Well, those individuals can apply for what is known as a Medicare Savings Program to help with Medicare Part B premiums. This slide communicates the income and asset levels that a person would need to meet in order to qualify for this program assistance. Now, if you know someone who could use this information, you can refer them to Access Nebraska, a division of DHHS, the Department of Health and Human Services. This is the program office that manages the Medicare Savings Program and other state economic assistance programs. Note that the asset limitation does not include the individual's home or their vehicle. Let's move on to Medicare supplements. Now, Medicare supplements are optional extra insurance that is purchased from a private insurance company licensed in the state. Medicare supplements are standardized, ensuring the company cannot modify the coverage that is provided. An individual is purchasing the same exact coverage from one company versus another, even if there is a difference in cost. The standardization also means that Medicare supplements are guaranteed renewable, meaning the company cannot cancel the policy as long as the individual pays their plan premiums, even with health problems. Medicare supplements pay for some of the individual's out-of-pocket costs, like deductibles, copays, and coinsurance, when the individual uses their Medicare Part A and or Medicare Part B. Now, what about provider access? Which providers accept Medicare supplements? Well, to put it simply, as long as Medicare Part A or Part B pays first, the supplement will pay after. There is no network consideration for Medicare supplements. Now, when considering a Medicare supplement, a person should remember this one major fact. There is a one-time guarantee issue period to purchase the Medicare supplement plan. This guarantee issue period is a 6-month window that begins when Medicare Part B is started for the first time at age 65 or older. During this time, an individual can purchase any Medicare supplement plan from any insurance company selling it, and they cannot be denied. Anytime after the 6-month guarantee issue, a person can shop for and potentially purchase a Medicare supplement. However, underwriting will become a part of that purchase process and will determine whether a policy is offered, and if so, at what price. It is important to understand this since it may affect future options and cost. Individuals interested in Medicare supplements can contact Nebraska SHIP for more information. We will provide a full listing of plan names, phone numbers, and cost for all insurance companies selling supplements in our state. Other information will include discount information, company ratings, and market data. This information is available upon request and only requires the individual to share their zip code, age, gender, tobacco status, and desired plan. When considering a Medicare supplement, it is important to understand the differences in what the various plans offer. This matrix provides a review of what the individual standardized Medicare supplement options provide. Due to the standardization, all Medicare supplements must offer coverage of 6 basic required benefits. Medicare Supplement Plan A offers full coverage of only these standardized basic required benefits. Cost varies based on age, gender, area, and tobacco status. An evaluation of cost for a 65-year-old male non-tobacco user in Nebraska can show Plan A will range between $89 and $402.42 per month. Cost for a 65-year-old female non-tobacco user in Nebraska can range between $86.20 up to $349.93. This option does see companies providing a HH discount or household discount between 5 to 15%. Medicare Supplement Plan G offers the most coverage, including full coverage of 4 additional benefits. A 65-year-old male non-tobacco user in Nebraska can expect costs to range between $108.49 up to $612.44. A female, same age, and tobacco status will see similar cost, however slightly lower than that of the male counterpart. And do note that this option does see companies offering a household discount between 5 to 15%. Now, individuals who may be seeking coverage that is a little more comprehensive, but perhaps with a lower premium, that individual may consider Supplement Plan K, which covers 2 additional benefits. However, this option provides only partial coverage at 50% for these and 3 of the 6 basic required benefits. An individual choosing this option is taking on potential higher out-of-pocket cost with the usage of the insurance in exchange for lower premiums. Plan K out-of-pocket cost is limited to $6,220. A 65-year-old male non-tobacco user in Nebraska can expect rates for a Plan K to begin at $58.11 and range through $190.63 per month. A female with these same stats would find premiums between $50.60 up to $169.18 per month. And note that this option does see companies offering a household discount between 5 to 7%. Now, when evaluating Medicare supplements, it's important for a person to choose the level of coverage that is most appropriate for their needs, and certainly note that the cost will fluctuate based on the coverage chosen. Now let's talk about Medicare Part D prescription drug coverage. Medicare Part D plans pay for brand name and generic prescription drugs. Plan formularies include at least 2 drugs in the most commonly prescribed categories and classes. There are 28 plans available in Nebraska this year, with monthly premiums ranging between $7.30 up to $104.70 per month. Individuals with higher income may see an IRMA and are notified by the plan by letter. Deductibles can range between 0 up to a maximum of $445, and a person may encounter copays and or co-insurance for their prescriptions depending on the drugs that are in question. That copay range can exist between 0 up to 40% of the cost of the drug. Now, your actual drug cost is going to vary depending on the prescriptions that you are using, whether or not the plan that you chose has those drugs covered on their plan's formulary, and of course, where those drugs lie within that formulary's tiering system. Also, the pharmacy that you use will affect your cost. Plan pharmacies can have a preferred, standard, or out-of-network status. Enrollment into Medicare Part D may be done when an individual is first eligible for Medicare during their initial enrollment period. An individual may also enroll into Medicare Part D during a special enrollment period at retirement if working beyond age 65. But note that special enrollment periods can be created through other life-changing events, such as a change of address. Should a person not enroll during their initial enrollment or special enrollment period, they may elect Medicare Part D during the annual open enrollment, which begins October 15th and runs through December 7th of each year. Coverage elected during this time will be effective on January 1st of the next year, and depending on the individual situation, late penalties could apply. To sign up for Medicare Part D, a person may visit Medicare.gov, the official U.S. site for Medicare, or contact Nebraska SHIP. Now, in order to avoid Medicare Part D penalties, you should join a plan when you are first eligible or during your special enrollment period. Medicare Part D is different than Part A and Part B when it comes to creditable coverage. Part D does recognize insurance from other sources as creditable for Medicare, such as COBRA insurance from a retiree plan or the VA. Now, if you have creditable coverage from another source, you are not required to enroll into Medicare Part D, and you would not see a penalty if you were to elect this coverage in the future. Also, if your work insurance sends you notices of creditable coverage, you will want to keep those records in the event that your Part D plan asks for verification of creditable coverage upon enrollment. And for those individuals who may have low income or resources, help is available to pay for Part D cost, known as Extra Help or LIS, a low income subsidy. Individuals or married couples will need to meet these income and asset levels in order to qualify for Extra Help. Note that the asset limitation does not include the individual's home or vehicle, but all other assets will be considered. Applying for Extra Help may be done online using Social Security's website or contact Nebraska SHIP. To recap, original Medicare and its potential premium cost. Medicare Part A hospital insurance is typically premium free. Medicare Part B medical insurance has a standard premium of $148.50, but can be higher due to an IRMA. Medicare supplement premiums can vary depending on the chosen supplement plan, the company it is purchased from, and the individual's personal situation. This example shows a cost of $130 per month. Actual cost will vary. Medicare Part D drug insurance premiums have a range of between $7.30 per month through $104.70 per month. Your actual cost will depend on the plan that you have chosen. Overall, an individual could expect total premium cost within original Medicare to be approximately $300 per month. Now, let's talk about Medicare Advantage. Medicare Advantage plans are the alternative to original Medicare and are purchased from a private insurance company approved by Medicare. This option should not be confused with a Medicare supplement. Medicare Advantage is a way to receive Medicare benefits, while a supplement helps pay for the individual's share of cost after Medicare has paid first. An individual must be enrolled into both Part A and Part B in order to enroll into a Medicare Advantage plan. Medicare Advantage bundles the Medicare Part A, the Part B, and typically the Medicare Part D into one package. This plan must offer equal or better coverage than that provided by original Medicare, and most offer coverage of services that original Medicare does not cover, like dental, vision, and hearing. Each plan will determine what extra benefits to offer and what limitations to impose. This option is growing in Nebraska, but there are some areas that do not have this option yet. We have 9 counties in Nebraska without Medicare Advantage, and they include Brown, Cherry, Dual, Dundee, Garden, Kimball, Red Willow, Richardson, and Sioux. Provider access is important to understand within Medicare Advantage. Plans in Nebraska may include PPOs or Preferred Provider Organizations or cost plans. These types of plans have a network that, when used, an individual should experience lower out-of-pocket cost. These plans do, of course, offer out-of-network coverage, making them a little bit more flexible. Depending on the chosen plan, an individual could be responsible for up to 50% of the cost when going outside of the plan's network. HMOs, or health maintenance organizations, are plans that are only available within a network and typically provide lower out-of-pocket cost for its members. It is important to remember that any services received outside of the HMO's network are not covered by the plan. The individual is 100% responsible for cost of services received outside of their HMO's network, unless in limited situations they are provided approval to use an out-of-network provider. Now, Medicare Advantage plans may also have prior authorization restrictions. An individual may be required to seek permission prior to receiving services or medical equipment, and in some cases, they may need to seek a referral prior to seeing a specialist. Each plan is different and rules do change from year to year. It is important to understand a Medicare Advantage plan in order to maximize its benefits. When seeking information about the coverage, rules, or cost within an Advantage plan, an individual should consult the plan's Evidence of Coverage. This resource can be found on the plan's website, and it provides specific information in how the plan works and what types of costs can be expected. When doing research on the options in Nebraska, remember that Nebraska SHIP provides a resource that outlines basic information about Medicare Advantage plans available in our state. When evaluating the Advantage plan options that you have, remember it's important to understand that there could be additional cost. Plans may have a premium and or a deductible for hospital, medical, and drug coverage. Also, Medicare Advantage does not have a Medicare supplement option that works with it. Instead, Medicare Advantage plans offer an out-of-pocket limit on the individual's cost. In Nebraska, that limit ranges between $3,000 up to $11,300 in 2021. Regarding the copay and or coinsurance structure, this is going to vary depending on the plan chosen. For example, a primary doctor visit or specialist visit within Nebraska can see a copay range or coinsurance range between 0 up to 20% of the cost. Labs, tests, x-rays could experience the same copay or coinsurance range. The cost of hospitalization can vary depending on the plan and the status of the stay, like within Original Medicare, an individual's status, inpatient versus outpatient, influences what the individual pays. Regarding extra benefits, Medicare Advantage plans will vary and have a dollar allowance for each service. In Nebraska, an individual may elect a plan that provides a dental allowance between $300 up to $2,000. Vision coverage has an allowance range of between $100 up to $310. Other benefits such as fitness, hearing, meals, and transportation may be available and have their own limitations. Review the plan's evidence of coverage will determine specifics. Finally, prescription drug coverage is available if provided by the plan. Cost will be determined by the actual drugs used and the plan's formulary and network. Enrollment into Medicare Advantage may be done when an individual is first eligible during their initial enrollment period, but certainly an individual does have an opportunity to enroll in the future within a special enrollment period. And note that special enrollment periods can be created through other life-changing events. Should a person not enroll during their initial or special enrollment period, they may enroll into Medicare Advantage during the annual open enrollment period. And again, depending on the individual's situation, late enrollment penalties could apply. To sign up for Medicare Advantage, a person may visit medicare.gov or contact Nebraska SHIP. To recap potential Medicare Advantage premium cost, an individual will need to be enrolled in both Part A and Part B and continue to pay their Part B premium. Depending on the chosen plan, an individual may see an additional monthly premium. In this example, we are using $26 per month, which results in a total monthly premium of $174.50 per month. This cost is less than that seen within Original Medicare.
Medicare Advantage services are paid for as they are received throughout the copay or coinsurance structure, and again has an out-of-pocket limit on spending. Pros and cons exist between Medicare Advantage and Original Medicare, and an individual should choose the coverage that will best meet their needs and budget. Nebraska SHIP can assist in this evaluation. So we've reviewed the two options of Original Medicare and the alternative Medicare Advantage, and we stated that the Advantage plan is required to offer equal or better coverage, but the out-of-pocket cost can vary between these two options. So let's go ahead and take a closer look at how these two options can differ regarding cost. So, to recap the potential premium cost, Original Medicare with a supplement and Part D plan could run around $300 per month, depending on the variables of the supplement chosen and the drug plan. This example shows $321.50 per month, which could mean that the total out of pocket cost for premiums over a course of a year would equate to $3,858. The alternative, Medicare Advantage, we do see significantly less cost regarding premiums over the course of the year. Remember that you will need to have both Part A and Part B in place in order to enroll into the Medicare Advantage plan option. In this example, we are showing a cost of $26 for the Medicare Advantage plan, equating to $174.50 per month. Over the course of 12 months, this individual is paying $2,094 in premium cost. So, as far as lower premium cost, we can see that Medicare Advantage can potentially provide lower premium costs. Now, of course, premium is just half of the equation. We need to also remember that utilization will have an effect on the out-of-pocket cost within these two options. With Original Medicare and a supplement plan G, for example, remember an individual is responsible for the Medicare Part B deductible. $203 is that amount this year. Beyond that, the plan G will help at the individual's cost regarding the other services. As we see noted, the primary doctor visit with 4 visits, a specialist visit at twice in the year, X-rays and diagnostic tests. This individual simply needed to pay their Medicare Part B deductible. Beyond that, again, all costs were handled between Medicare and the supplement. Now, the alternative Medicare Advantage plan, we will of course have those copays or coinsurance for services. In this example, there is no deductible for the Advantage plan, but we see a copay range for services as listed. With this individual's usage over the course of the year, this person's out-of-pocket cost equated to $405, which is more than paid through the Original Medicare with the Plan G in place. Now, when we add those out-of-pocket costs to the premiums paid, we see within Original Medicare with the Plan G, again, the total premiums over a course of 12 months equated to $3,858. When we add the out-of-pocket costs, the Part B deductible of $203, we see this individual has spent nearly exactly $4,061 over the course of the calendar year. When we compare the out-of-pocket cost for low utilization from an Advantage plan, in addition to the premiums, again, $2,094 is what this individual paid within this sample, or example rather. The total out-of-pocket cost is $405. When added to the total premiums, this individual has spent nearly $2,500, $2,499. So with a lower utilization, we see that Medicare Advantage could potentially provide that lower out-of-pocket cost over the course of the year than that provided by Original Medicare with a supplement Plan G. Now, let's look at an example of a higher utilization of Medicare benefits. So again, Original Medicare with a Plan G, an individual would be responsible for the Medicare Part B deductible, $203 this year. Beyond that, again, between the Medicare supplement and Medicare, we find that this individual has no other out-of-pocket cost. Even though they did see their doctor 4 times within the year, a specialist 6 times, saw a 4-day inpatient inpatient hospital stay, and 30 days within a skilled nursing facility care. Again, $203 is what this individual paid for these services throughout this hypothetical year. To contrast, Medicare Advantage, same plan. We do see that again, a zero deductible is included with this Advantage plan, and again, a range of cost depending on the services received. For the primary doctor visit, we saw a $5 copay. The specialist visit was a $30 copay. The 4-day inpatient hospital stay saw a $420 copay for the first 4 days. And then, of course, we see that the skilled nursing facility care also carries a daily copay for days 21 through 46. In this example, this individual has spent $3,670 in copays within this hypothetical usage in this year. Now, when we add this out-of-pocket cost from a higher utilization to the premiums, first Medicare Advantage, original Medicare with a Plan G. Again, $3,858 in premiums over the course of the year with the $203 Part B deductible paid. This individual, again, has paid $4,061 over the course of the year. All costs other than that are being handled by the Medicare Part A, Part B, and the supplement. Certainly, if this person is receiving prescription drugs, those costs would be in addition to this example. With regard to the Medicare Advantage plan, we again saw that lower premium cost, $2,094, but with this higher utilization of cost, $3,670 over the course of this year, those amounts added together equate to $5,764. Clearly, we are seeing that the higher utilization of insurance within Medicare Advantage can potentially result in a higher out-of-pocket cost versus that seen with original Medicare and a Plan G. Now, in the event of catastrophic situations happening, again, original Medicare with a Plan G, we're looking at the premiums, we're looking at the Part B deductible. Again, $4,061 is that potential maximum that a person would see, plus prescription drug cost, of course. The alternative, Medicare Advantage, in the event of a catastrophic situation, the example plan that we're using does have an out-of-pocket limit at $6,900. So that amount added to the $2,094 in premiums equates to a potential maximum total cost of $8,994. And again, certainly if this person is utilizing prescriptions within this hypothetical year, those prescription costs would be added to these amounts. So definitely usage is something to consider when you are evaluating your original Medicare versus Medicare Advantage plan options. Our final topic is Medicare fraud and abuse. Medicare is reportedly losing $60 billion annually due to this activity. An example of fraud is a provider billing for services an individual did not receive. An example of abuse is when a provider orders unnecessary tests or procedures. But Medicare also loses funds through compromised individual information. The result of this loss means lost tax dollars, which in turn puts the Medicare fund at risk. This results in less money for benefits, potentially leading to higher Medicare premiums or other costs. Now, of course, human error does exist, and not all errors are an instance of fraud or abuse. Most providers are honest. Unfortunately, fraud does happen, and only review and investigation will determine the truth. Now, in order to ensure that you do not fall prey to fraud or abuse, you can do three things. First, you can protect, simply meaning protecting personal information. You should not show or share your Social Security or Medicare number to an unknown source.
Protect this information the same way you would protect a credit card number. Also, it's important to securely destroy any documents and communications that have personal identifying information on them. And remember, Medicare or any other government agency will not call or visit you unless you have initiated the contact first. In limited situations, Medicare does conduct surveys, but they will notify you of that survey by mail prior to making that phone call to you. The next step that you can take to prevent fraud or abuse is to detect. Medicare sends resources to you when you use your Medicare benefits. These resources come in the form of a Medicare summary notice or an explanation of benefits. The Medicare summary notice comes from Medicare Quarterly and details what was paid for on your behalf when you used your Medicare Part A and or Part B. The explanation of benefits will come from the drug plan, the Medicare supplement plan, or the Medicare Advantage plan and is received on a monthly basis. Another resource that you can use is a healthcare journal. You should make notes of the dates you received a doctor visit, the doctor that you saw, and what you and that doctor discussed. This information can then be compared to that information provided by your Medicare summary notice or explanation of benefits. If you find something questionable, you should report it. Ask questions, contact that provider, and inquire about the item or service in question. This may result in discovering a simple human error and resolve the problem. Second, an individual may contact Nebraska SHIP to report questionable charges. Remember, we serve as the state's SMP. Now these steps are important to prevent fraud and abuse. Victims of fraud or abuse can see adverse effects to their Medicare benefits, potentially resulting in a denial or a delay of benefits. Remember, protect, detect, report. Now, regardless of what option you choose, Original Medicare or Medicare Advantage, you should remember that you will have an opportunity each year to evaluate your coverage and make changes for the next year. This period of time is known as open enrollment and comes every fall, beginning October 15th and ends on December 7th. Open enrollment is your chance to evaluate your options. Your cue that open enrollment is coming will be the receipt of your annual notice of change in September. This notice will communicate any changes in the coverage, cost, or your service area. This notice will communicate these changes are effective January 1st of the next year. If you do not get your annual notice of change, you should contact your plan for another copy. Now, during open enrollment, you should contact Nebraska SHIP. We can help compare your current plan to the options you have available in the next year. Our program was able to save Nebraskans over $14 million in prescription cost in 2019. That is how important this time period is, and we encourage everyone with Medicare to take advantage of their opportunity to evaluate their options and make changes if they can find better coverage or lower costs. To conclude, Nebraska SHIP is available to help. We provide Medicare education and counseling over the phone, in person, or through video conferencing via WebEx. We can help compare plan coverage and costs during the enrollment process or after. We provide fraud prevention education and are a source to report suspected Medicare fraud. We assist with low-income subsidy applications and can answer questions about assistance programs. We are happy to provide education to groups and welcome Nebraskans to call our toll-free hotline or visit our website. From the staff and volunteers at Nebraska SHIP, we thank you for watching. Have a wonderful day.